What is the risk of hepatitis C reinfection after cure? Imagine finishing a long journey of treatment and feeling relieved that the virus is gone. But then, you wonder, can it come back? That's what we're exploring today. When someone is cured of hepatitis C using effective medications, they are no longer infected at that moment. However, the risk of getting hepatitis C again depends a lot on what they do afterward and their environment. Hepatitis C is mainly spread through blood-to-blood contact. So, if someone continues to share needles or other injection equipment, their chance of reinfection is higher. Studies show that among people who inject drugs, the reinfection rate can be between about 1.8 and 11.4 cases per 100 person-years. That means if 100 people who inject drugs are followed for 1 year after treatment, roughly 2 to 11 might become infected again. The highest risk tends to happen within the first 6 months after cure, especially if risky behaviors continue. Over time, if they stop sharing needles or engage in safer practices, the chance of reinfection drops. For people who do not have ongoing high-risk behaviors, the chance of reinfection is much lower, often less than 1 per 100 person-years. This is because they are less exposed to the virus. But if someone has other health issues like HIV or continues to participate in risky activities, their risk can be higher, sometimes up to 15% over 5 years. It's important to remember that hepatitis C treatment with direct-acting antivirals does not give immunity. If a person is exposed again, they can get infected. That's why harm reduction strategies like needle exchange programs, opioid substitution therapy, education, and regular testing are so vital. These measures help prevent reinfection and protect liver health. Reinfection can be concerning because repeated infections can cause ongoing liver inflammation and fibrosis, which may lead to cirrhosis or liver cancer. But the good news is that if reinfection occurs, it can usually be treated successfully again with the same medications. In summary, the risk of hepatitis C reinfection after cure depends mainly on ongoing exposure to the virus. The highest risk is shortly after treatment, especially among people who inject drugs or engage in high-risk behaviors. Over time, with safer practices and preventive measures, the risk decreases. Protecting your liver health means staying vigilant, avoiding risky behaviors, and working closely with healthcare providers for testing and support. Always remember to seek personalized advice from medical professionals to best protect your health.